Metabolic Syndrome, Diabetes, Part 4. We're going to talk about how we get rid of the inflammation, which is one of the root causes. Is it the only cause? No, it's not. And this is not medical advice. I'm not telling you what to do with your medications. It has nothing to do with medication, nothing to do with surgery. This is about wellness, lifestyle, what I am trained in, a 3,000-year-old medicine. So inflammation, the three main causes of inflammation. Is it the only cause? No, it's not. But these are three main ones. I call it the three stresses. It's physical stress, chemical stress, and emotional stress. So we're going to talk about one at a time. Today we're going to talk about chemical stress, okay? Chemical stress, what is it? That's anything you put in your mouth, you put on your skin, you rub on your skin, you breathe in. All of that creates chemical stress, which increases inflammation, which makes your blood sugar metabolism worse. Now, if you can decrease that, then that decreases the inflammation and it makes your blood sugar metabolism better, right? So what you put in this is the reason why diet is so important. Probably no one ever told you, right? It's not about just losing weight. It's about decreasing the foods that you put in your mouth. They either increase inflammation or decrease inflammation. If it increases inflammation, guess what? It's going to make your diabetes worse. If it decreases it, guess what? It's going to help restore your organ function and your body will be able to solve it by itself, okay? This is not medical advice. This is nutrition. This is what I was trained in 3,000